patient comes to HSS Spine, what they should expect is the highest level of care, not just from the surgeons, who are spectacular technicians and caregivers, but also our PAs, our nurses, and they should expect that they're going to be treated as if they're a member of the caregiver's family.
They should expect that they're coming to a place that has expertise in treating all types of spinal surgical problems. It doesn't mean everyone will have surgery, but when it's necessary, we've seen every problem and we can take care of it.
What's unique at HSS Spine is that patients come to an institution that has been really specialized in orthopedic care for over 100 years. We have an enormously rich culture that is all about patient care, incredible resources, fantastic research, and I think patients can expect to be treated really at the top of any care that you could get worldwide for orthopedic problems.
We use a team approach. It's collaborative, it's integrated between the non-surgeons and the surgeons, and we individualize the care that the patient gets.
HSS Spine, we have a dedicated spine pain team.
We run the gamut and spectrum of all kinds of pain management. Patients who have surgery get sophisticated local blocks that may keep them comfortable and enhance their rehabilitation day 1, day 2, day 3 after their operative intervention.
Great outcomes come from great teams.
When the patient is evaluated, we understand that they have a specific pathology that is inherent just to them alone. And so what has to be developed is a treatment plan that is related to their specific pathology. Whether it's surgery or non-operative care, it is personalized to what they need.
So it may be just figuring out what the goals are of the patient and personalizing around the patient and their expectation, and not around what we see on an X-ray or an MRI or what their diagnosis is.
Volume is related to outcomes, and the higher volume of procedures you perform, by any definition, the better you'll become.
It's been shown many times that the more something is done, and done by a protocol, and we are very protocol driven, the results will be better, the outcomes are better. It's better for the patient.
We're the busiest spine center in the nation. That means that a lot of things that are unusual or rare at other centers is something that might be quite routine here.
Whatever is state of the art, whatever is necessary is here. We have access to all the best technologies, and we've helped develop a lot of them, so we know how to use them.
Phenomenal imaging equipment, navigation equipment, and really a number of technologies that make the procedures incredibly safe and much more reproducible and reliable and predictable for our patients.
The best carpenters have the best tools, in a sense, or the most sophisticated tools, and I think we have those at HSS.
Anytime someone has to face a medical issue or has to go through surgery especially, it's very stressful. The thing that can lessen stress is the knowledge that the hospital has done this many times, that it's a team approach, that the patient's best interests are our best interests, and that they'll be well taken care of.
What I always say is, if a patient's going to have surgery, I'm nervous if they're not nervous, because it's a stressful situation. But what they should know is they're going to have the most experienced team taking care of them, and they're going to be treated like they're part of a family.